Hello, good morning. Can you hear me? Yeah, okay. So good morning, good afternoon, everybody. Thanks for joining the session. We're gonna start now. So I'm gonna hand it over to Beth Plowman. So she will give a couple of words welcoming you, introducing the session, and we will start now. Thank you. Beth, over to you.
Okay, great. Thank you very much, Edward. I would just like to thank all of the colleagues and participants who have joined us here this morning. Thank you and welcome to this webinar on a program evaluation, which examined protecting children on the move in the Horn of Africa. This was an evaluation of a program which covered 2 regions and 3 countries. And today we'll be hearing from the evaluators as well as our colleagues in the 3 country offices involved about their experiences. Important to note that this evaluation was indeed quite impacted by the COVID pandemic. Nonetheless, the team working with colleagues has been able to bring it to quite a successful completion. And importantly, it's at the stage now where it's really available for our use and utility in improving programs. So with that, I would just like to say, we look forward to hearing about the findings and the recommendations and hearing from the team and our colleagues. And with that, I'd like to turn it back over to Edward for some introductions. Thank you very much.
Thank you very much, Beth. Thanks, colleagues, for your participation. What we're going to have is a between 25 28-minute session now, where Una, the evaluation team leader, is going to present mostly the findings and the recommendations of the evaluation, and then following that, we're going to open the floor for a session of Q&A, and then finally we're going to have a HQ Child Protection Section, Noela Barasa, just saying a couple of words on what is the way forward for this evaluation, what is the management response process now that is already going on. So I hand it over to you, Una. Thank you very much.
Thank you, Edward, and delighted to be here to share some specific findings from the evaluation and allow a discussion to follow. And thanks to Noela, Beth, Edward, and just to say I'm presenting the hard work of our evaluation team, which was made up of Reem, a senior child protection specialist, Nahashon, who's a monitoring specialist, Marielle, who's an embedded team member from UNICEF. Then we had Saiful, who's a national consultant from Ethiopia, Abdi Aziz, who was the national consultant from Somaliland, and Ibrahim from Puntland, and Rasha from Sudan. So it's all of our work together. Okay. So just to give a bit of background and context for this evaluation, we're concerned with this region, the Horn of Africa, which has high mobility and mixed movement of people, including victims of trafficking, unaccompanied minors, refugees, asylum seekers, and people seeking better livelihoods. And there's the figures are there for international migrants globally. But in this particular part of Africa, there's 3 distinct routes. There's the northwestern route from Eritrea, Ethiopia, Somalia, through Sudan, Libya, and sometimes onto Europe. But there's also the eastern route through Yemen and Saudi Arabia, moving towards Saudi Arabia and beyond. And then there's the southern route along the eastern corridor down through Kenya and down to South Africa. So there's 3 distinct routes, but there's a lot of internal migration within the countries as well. So this program was funded by the UK Foreign, Commonwealth and Development Office, and it was part of a larger initiative which was ending violence, abuse and exploitation of children. So it had 2 parts, a partnership to end violence against children. And what we're presenting today is the orange part there on the right, which was the program in Ethiopia, Somaliland, Puntland and Sudan. So it ran between 2017 and 2020, December 2020. And there was an investment of 10 million UK pounds. So the aim was to better understand and respond to the vulnerabilities faced by children who migrate in the Horn of Africa. So overall, the programme focused on boys and girls, especially the most vulnerable and those on the move, to protect them from all forms of violence, exploitation, abuse. So that was kind of the overall goal. But it was built, the programme itself was built around 5 outputs. And the first one was down the bottom left there, to strengthen case management systems to improve the services for children on the move or children who are at risk of exploitation and abuse. The second output concerned training and building the capacity of the social services workforce so they could respond to children at risk. The third one there, the green one there, is to improve access to social services and protection services for children, but also to provide information on available migration, safe migration options, and information on the risks of irregular migration to children and communities. The fourth one, the one in yellow, was about information. Both quantitative and qualitative data should be available to enhance knowledge on children on the move, as well as inform the programme on children on the move. And this was done by UNICEF's, quite a lot of this work was done by UNICEF's Office of Research in Oshenti. And then the fifth one there was improving access to legal protection for children, such as support provided towards laws or birth registration. So they were the 5 outputs from the programme. And the evaluation objectives were typical evaluation objectives to look at the relevance, the effectiveness, the sustainability, and the coherence of the programme. But also the evaluation began just as COVID was hitting globally and hitting the region. So we also looked at how well UNICEF our country offices adapted the programme to COVID, the crisis, COVID-19 crisis. But the main aim, it's a formative evaluation, was to provide lessons and recommendations for UNICEF's leadership and advocacy, their strategies and methodologies, and also partnerships for strengthening, I suppose, national capacities to respond to children on the move. So methods that we used were key informant interviews, a desk review of the relevant documentations, and we did 3 surveys. And the slide there shows, we interviewed UNICEF partners, a lot of partners actually, other stakeholders and donors. 2 documents were really key. UNICEF had previously done an evaluation in 2019 on strengthening child protection systems. So that was a really key report that we followed up on, that evaluation report. And also UNICEF's global program framework for children on the move. But also we looked at, documents from IGAD, from the Social Service Workforce Alliance, and also the Alliance for Child Protection and Humanitarian Action, as well as the program documents. Just a quick word on the surveys. We surveyed UNICEF staff, implementing partners, but the Social Service Workforce Survey was very important, bearing in mind that this was during COVID. So we tried to adapt the methods to reach social workers on the ground. And we used a kind of, 5, more is less, 5 questions that we could ask electronically. And we did that with, in Ethiopia, we used Rapid Pro, which is SMS text. In Sudan, we had to use a phone survey. And then in Somaliland and Puntland, we used an online Kobo toolbox system, but it was the same questions more or less. So we were quite happy that we were able to reach the social workforce despite the COVID. Okay, there was a number of limitations. We had to make very careful use of the Innocenti research results because we were unable to use consultative approaches to reach children on the ground and capture their voices. We were conducting the evaluation as the programme was still being implemented, so we had to continuously check earlier interviews and be careful that we weren't saying something that happened later, but we were saying it hadn't happened, or it hadn't yet been planned. Contribution is always a problem with evaluations. Attribution aspects are always a problem, and whether for evaluations. And the other challenge was that there was a lack of qualitative data in the reporting systems. It was mostly focused on quantitative data. Okay, as part of the evaluation, we were asked, there was a theory of change developed, and that, you know, contains the assumptions about how change will happen. So we were asked to develop theories of action for each location where the project was run. And these kind of look more at, I suppose, the things that are more under UNICEF's control, the program's control, the inputs and activities. So they describe the different approaches and different actors involved in the different locations. So in the annex of a report, it's really interesting to compare the theories of action for the different locations, because they had the same outputs, but you know, they had different actors and different activities leading to the outputs. And we developed these theories of action in a consultative way with the country offices. Moving on to findings from the evaluation. Now here, when we get to some specific findings, and the program focal persons will jump in and provide some more nuanced findings from their country. So yeah, so the program was broadly appropriate to the rights of children on the move. And there is a pressing need to strengthen basic services for children on the move, and, you know, enhance access to services along routes and in transit locations, so that children get continuous care. But the built-in logic in the theory of change wasn't inevitable, because it relies on coordination across services and access to services, and you know, that wasn't always the case. And you know, one person said in an interview that it was kind of like building a car while driving it, and it wasn't working properly, but you still need to drive it and improve it as you're driving it. So that was one of the challenges in the program. There was a strong focus on identifying children with different needs, but the program wasn't designed to address the root causes of vulnerability. Although in Somaliland, there was some community work on addressing harmful norms, which sometimes results in children leaving the location where they were brought up. And the Upshift Youth Social Entrepreneurship Program also tried to address some of the livelihood options for youth in Sudan and in Somaliland and Puntland. But it wasn't necessarily designed to address the root causes of vulnerability. And it was said quite often that, you know, once you help these children, many more children will come along, or there are many more children who can come along. It was very relevant to UNICEF's priorities and role and the long-standing activities in the three countries, and particularly looking at the humanitarian and development nexus. So it goes beyond the emergency phase. It's because it had a focus on system strengthening. So it was really looking at long-term systems, setting up case management systems, but learning from the humanitarian work that had been done. So the partners like the IOM, the International Organization for Migration, and UNHCR were involved in the program, and they helped to address the immediate situation for children. But the program really demonstrated this humanitarian development nexus, where it also linked to longer term system strengthening approaches. And also sometimes the humanitarian case management tools are there. So they borrowed some of the tools from humanitarian child protection standards, so that and made sure that both were aligned. Another part of it was the UNICEF's the Child Protection Information Management System, Primero, which isn't just a UNICEF software or system, but that was used, and that helps to ensure that the humanitarian and case management systems align. Okay, so it aligned with national priorities on child protection, and had some success situating within existing frameworks. The governments were the primary partners, and there was very high alignment with government child protection systems. The knowledge and reporting part of the project or the program, the research component, which was done by UNICEF in Oshenti, was really important, really pertinent, and it really will add value as a public good and will contribute to future work. There's a lot of really good detail in the research, qualitative and quantitative research conducted by Oshenti in 3 countries. It wasn't able to inform the program itself because it was taken in parallel with the program implementation. The program hasn't yet documented what works for children on the move and how this may vary depending on, you know, different categories of children in different contexts. And there was no system for regular feedback from children, or, you know, an information system that pulls out this information. And that's a challenging thing to do. Although Primero and the Child Protection Information System Plus will maybe provide opportunities for that in the future. Reporting was mainly towards outcomes, and program just demonstrated a lot of adaptability to COVID. It adjusted very quickly and early to the COVID crisis. Talking to the government partners, they perceived the program to be inclusive, although this wasn't always replicated at regional levels of government, but at national level and federal level, they perceived it to be very inclusive and answering to their needs. With respect to engagement of children and accountability to affected population, efforts were made to ensure that PSEA was included, particularly with partners of the program, or that people were aware of this. This didn't always go down to local government levels. And with respect to AAP, reporting and feedback, I said this already, feedback mechanisms for children were not really considered in the program design and implementation. So one of our recommendations was that that could improve. Then with regards to sustainability, it adopted a system strengthening approach, which is sustainable in the long term, but it requires more investment and more resources, and also the continuum of services for child protection is a challenge in the region, a challenge in all regions. So infrastructure is still required, you know, with better coordination across different government departments, and kind of capacity building for the social service workforce, and new knowledge and skills takes a lot of time to be assimilated fully into work practices. So I guess you could say that the program was very ambitious in what it was trying to do, and what outputs it was trying to achieve, and it went some way, but it takes a long time for these things to happen. And UNICEF is fully aware of the risks for sustainability, including those outside their control. The evaluation team were wondering if a predominant focus on government actors is sufficient really to reach sustainability, and we kind of think that it also requires that there's a demand from civil society to advocate for better services in the long run. So you need people pushing for these, as well as, you know, the government providing them. Okay, so turning to, I suppose, the effectiveness of the specific outputs of the program. I've mentioned a few of them already, but good progress was made in case management, getting national authorities to support consolidating case management from different systems and across different government departments, and also building the capacity of social service, the social service workforce. There was good progress in accepting the value of and use of a digitalized system for for case management in Somaliland in particular, and the readiness was there in Ethiopia and also in Sudan, although it hadn't been rolled out. Despite, you know, some progress, which included a mapping of case management at borders, and a mapping of the gaps really that are there. Cross-border case management as designed in the program didn't proceed as expected in the 4 locations, but our Somalia colleague will talk a bit more about some successes that they had on the border with Somaliland and Ethiopia. But in February 2020, I think it was, yeah, February 2020, there was a meeting with all countries, and the mappings that were done at cross borders were presented, and I think amongst UNICEF staff there was a consensus on what is involved with cross-border case management, and there was a better consensus of what this actually means in practice. And towards the end of the project, the Child Protection Office in New York built on this and built on the experience, and they developed a theoretical flow chart for cross-border case management, and I think that has been shared across UNICEF. So progress has been made, but probably again, it was a bit ambitious about what could happen. And some at the Togo-Ajali border in Ethiopia and Somaliland, there was efforts made for social workers to begin to contact each other across the border. But cross-border case management really relies on having a strong national system to refer children once they've been identified across the border. Sorry, the social workers were placed there by UNICEF. They weren't there before. Steady progress was made on the recruitment, training and certification of social workers, and this followed different processes in the different countries. In some places it was done through university curriculum and through funding social workers and community workers to attend courses, and in Ethiopia the qualifications and competence levels for social workers and community workers were agreed upon and developed. So that is social workers. And then the awareness raising activities followed quite different patterns in each country. There was less involvement with the community for returnee children. So that goes back to the point about the continuity of care. And a lot of children came back from abroad with COVID or were sent home after COVID struck. So this provided an opportunity to demonstrate the importance of having social service workforce to work with these children. But it's still difficult to make sure that what happens to these children once they go back to their communities, the follow-up with the children is a challenge. The Upshift program, which is a UNICEF livelihoods social entrepreneurship program, achieved mixed results in providing skills to disadvantaged youth. It was in Somaliland, Puntland and Sudan. It wasn't run in Ethiopia. And graduates, you know, it's difficult to follow up with the graduates what happened to them next, but I believe that's been happening since the program finished. And then progress was made with regard to legal protection in line with other UNICEF work on this, and there was, you know, some really good examples of progress on legal protection. Okay, so I'm going to hand over to Tahani from Sudan, and she's going to give you more nuanced approach to case management and contribution to the family tracing and recruitment.
Hello, everyone. Given the very limited time given, I will just highlight some keywords, and maybe during the discussion we can elaborate more. The first point that I want to highlight is that the challenging nature of case management in Sudan, with existence of different case management system in the country, and also the lack of a digitalized, reliable information management system for unaccompanied and separated children. So this is the main challenge in that. Actually, the case management and the Innocent T report, I think the Innocent T report supported a lot designing the program in relation to strengthening the case management. And I think the delay in the implementation of the program due to COVID-19 and also due to the political change in the country give us some room to use also the outcome of the research. The other point that also contributed to strengthening the case management in Sudan is that at the time of the Innocent T report, we also have another report, which is the ISS report, which is also focusing on the case management system in Sudan. So we tried as much as possible to have two documents that give us a very concrete evidence in relation to how we can improve the case management for children on the move. And I think this is really supported us in leveraging the resources and also building a strong system for case management, moving beyond the traditional route to another route, which is through the northern part of the country, which help us also indicating one of the northern state as one of the pilot state for the case management, and the introduction of the Primero as a digitalized case management system in the country. Actually, the good thing also about this is about this project, and also as part of the sustainability that we are all looking for, is that we built our intervention based on our previous intervention in different areas in relation to case management. Like we built on the recommendation of the social service workforce mapping, which we conducted end of 2019. We also really built on the endorsed and signed FTR SOBs, which is like the introductory part to the Primero in Sudan. So we built on existing intervention, and this is how we are now looking for sustaining the results through the FCDO. And now we really managed also to achieve a lot in relation to case management. The first thing is the signing of the ISP. I think this is also a great achievement, and also the identifying of the users. I think this is also one of the issues that can improve the quality of the provision of services in relation to case management. One point is in relation to case management, different UN agencies as well as international organizations are part of the process of the rollout, and as part of the also the user, like UNICEF and Save the Children. And I think this is also good that we managed to involve as much partners in the system, and of course with the buy-in and the ownership of the government and part of the whole process. One last point that I really wanted to make is that the recommendation and the findings of the evaluation, the findings and recommendation of the Innocenti as well as the ISS report contribute to developing an action plan based on the recommendation and the findings. And now this plan is really like our roadmap for the implementation. And I think by this we will really ensure the sustainability of all the outcomes and the findings of all these three major documents. I will stop here and I will hand over to Aminyor from Ethiopia.
Hi, good afternoon, colleague. I'll be very quickly focusing a little bit of details on how we made sure the programs that we have done here is owned by the government and is helping the sustainability of the programs that we have done under the Children on the Move. So I'll focus on two issues: case management and strengthening social service workforce. So we actually made a deliberate effort here to work closely with the government partners, different ministries at the federal level and also at the regional level. So we took advantage of our existing relationship with the government partners and worked to make sure that the interventions that we have planned under the Children on the Move program are actually integrated into the regular government work plan and into their priorities in terms of child protection system strengthening. So in doing so, we focused on, as I said, case management framework. So it has been developed, tested, and now being rolled out throughout the country in development and emergency context. And we did it through the Ministry of Women, Children and Youth. Now the training manuals have been developed, and at the very outset of this COVID-19 in April 2020, we managed to adjust these case management framework and tools so that it can respond to COVID-19, also to some extent the cross-border case management. So now we are also in the process of rolling out a remote training package, which we have done interactive voice recording method with the help of VMO. So it's been rolled out for the case workers on the ground. In terms of social service workforce, we have been working with two ministries jointly at the normative framework level, where we have supported the government and is now integrated into their plan through a national leadership group. We are doing a mapping and assessment of the social service workforce here in Ethiopia. We supported to develop the occupational standard training materials, curriculum development, which is now being delivered through institutional mechanism, meaning that technical and vocational educational colleges. And we have supported the government to engage social workers on the ground. In this country, we don't have that many social workers. Through this project, we have engaged around more than 550 social workers. But now, after the end of the project, many bureaus in the regional level are continuing to engage those social workers. So now through UNICEF, other resources and also regular resources, we are supporting around more than 1,000 social workers on the ground, including in the emergency locations. These together have created great demand. In fact, on the ground, as you can see, I have put a social worker with the Minister of Women, Children and Youth on the slide. And you can see after visiting a quarantine center, which was accommodating the returnee children during the COVID-19, she was saying why it is that we think a social worker is less important than a doctor or a nurse. So that's why we have created a great demand, not only within UNICEF supported project, but within the government mechanism, Ministry of Women, Children and Youth, and their bureaus on the ground, Ministry of Labor and Social Affairs, their bureaus on the ground are now looking forward to establish a social service workforce who will do the case management for vulnerable children on the ground, and through a methodological process and institutional mechanism. Look forward to that. And if you have any questions regarding more details, I'm here to answer during the webinar and after the webinar. Over to Una.
Thank you, Amanu. And I think Tahani provided a really nice example of, the roadmap for implementation and building on all the outputs from the evaluation. And I think you're showing really how the importance of demonstrating to people the importance of social workers for child protection. Okay, we'll go to Somalia in just a moment, but just a few words on partnerships and collaboration. I think the Children on the Move program demonstrated how important it is to have multiple actors to work together. And Amanuel mentioned 2 ministries, and it is challenging to get people to work together and have agreed upon common identification and referral mechanisms, and that takes time. But it did demonstrate the importance of this, as well as other actors outside government and other UN agencies who can support different aspects for children on the move. Another point on collaboration was that the program technically applied to all children on the move, and that was the intention. But in practice, responsibility for various categories of children on the move is fragmented amongst agencies and government structures. And that often results in a lack of coherence. And that is, again, a very challenging thing, and it can't be just corrected, because there's years and years of how refugee children are sent off here, asylum seekers are here, street children are here. So sometimes the term children on the move was confusing to program partners, not to UNICEF staff, but to program partners. UNICEF focus on strengthening national systems was found to be really an essential step towards cross-border coordination. And you can't really do cross-border coordination unless, I said this already, unless there's a strengthened national child protection system. Lawrence from Somalia will talk about that just in a second, about how they approached it in Somalia. Just 2 other points here was that coordination across formal and informal actors requires more emphasis. And I think that it depends on, the Innocenti research really showed us who children trust and they don't, or who they don't trust, and they don't trust authorities. So it's important that informal actors are also involved in programming for children on the move. And the last point there is that there was, good examples of coherence within UNICEF itself, despite some exceptions. We felt in some places there could be better linkages to the UNICEF social protection systems or social protection programs for prevention or reaching vulnerable communities, and it's hard to align those sort of programs. But there was definitely clear synergies between the research component and other studies conducted by UNICEF and others. But back to Somalia, and Lawrence will tell us a little bit more about how they approached partnership on cross-border case management. Thank you, Lawrence.
Yeah, thank you very much, Una, and hello, colleagues. I'd like to talk about how our partnership with IOM was strengthened through this Children on the Move project, which was funded by FCDO. Now, the whole idea was to strengthen our cross-border case management and ensure continuum of care for children who cross into Somaliland and Puntland from Ethiopia, from Sudan, and in some cases also from Kenya. And what we did was that we developed cross-referral SOPs between UNICEF and IOM, in that we leverage on the FCDO funding to develop child protection case management SOPs to ensure protection of children on the move. And the IOM also integrated our needs into their own assisted voluntary returns and integration SOPs, so that we could undertake cross referrals. For example, having UNICEF refer children who are stranded in our shelters to IOM for family tracing and identification back in Ethiopia, while IOM would refer children who are stranded to our shelters, and they would stay there as their travel papers are being processed. IOM and the UNICEF also gently conducted trainings and capacity building of the police, immigration officers, social workers, and other civil society organization staff on anti-trafficking, child-sensitive case management, smuggling, assisted voluntary returns and reintegration, among other activities. And this really meant that the police checkpoints were able to screen for migrants and even screen for traffickers, and had these ones referred back to our partners for case management. And in the recent past, even up to last week, there were some traffickers arrested in some parts of the country with up to 22 children who were rescued and handed back to their families. So we've seen a great success in this partnership. And one other activity we undertook jointly with IOM was to advocate for the release of children from detention. And we saw this when we had almost 280 children who had been detained by police and immigration authorities of Puntland, who we then advocated through the Ministry of Interior, and these children unfortunately were released. Some of them needed protection, others needed care, others needed cross-border returns and integration back in their communities, and this was handled through this partnership. This resulted in up to 10% of the total number of children that were released from prison, from detention, from remand, being from this joint partnership. And this partnership with IOM led to last year having 35 children returned back to Ethiopia and reunified with their families. But then due to COVID, the borders closed and we're not able to reunify more children. But early this year, we've had about 27 more being returned back to Ethiopia and reunified with their families. Some of the challenges which we have experienced in this program include: one, the impact of COVID-19, in that when the borders were closed, we could not continue with the cross-border returns for children until these borders were open towards the end of last year. And funding, especially for cross-border FTR, has been a challenge, and especially for IOM, there have had challenges in terms of flying the children out of Somalia back to Ethiopia, to Sudan, because it's quite costly to undertake these kind of activities. And also, despite ongoing advocacy against detention of children, we still see some pockets of arrests happening along the cross-border points, for example, in Togwajale, on the border between Ethiopia and Somaliland. And what generally happens is that these children are arrested, then taken through the court process, and just dumped across the border. So we are trying to advocate that these children should continuously be handed over to the care providers who are supported by UNICEF. Thank you very much, and I'm happy to respond to any questions after this session. Thank you.
Thank you, Lawrence, and that's really useful examples from Somalia. Okay, so just to conclude the presentation before a chance to ask questions, we came up with 6 recommendations from the evaluation. There was something like 23 findings that were consolidated into 11 findings, and then we have 6 recommendations. So the first one there is that, I mentioned this already, confusion around from partners around the umbrella term children on the move during implementation. So, you know, it can create confusion in implementation, but we feel that stronger and consistent, simple messaging on the duty to protect all children, irrespective of their status, you know, needs to be, UNICEF does this already, but continue to be disseminated in various fora and media channels and translated into styles and languages that governments and service providers understand. Because we mentioned that, you know, the system is fragmented, but that message needs to continuously come across that children shouldn't be detained. All children are entitled to protection. The second recommendation there is around realistic targets for system strengthening programs. And again, I've alluded to this already. It takes time. This applies to the outputs that, or the outcomes that similar programs may wish to set up in cross-border collaboration. So really have to emphasize, and I think it came out with what Lauren said, that when children are just dumped across the border, that cross-border child protection, it relies on strong national child protection systems, and it can only work when these systems collaborate and coordinate with each other across jurisdictions. The third one there is around the balance between a system strengthening approach and community-based support for children on the move, for realizing rights and providing services. And clarity is required on the type of engagement and support that UNICEF field offices can or should be providing to community-based protection networks. So mapping the role that other agencies play in this regard is important, and partnerships with other UN agencies on the children's right mandate is important as well, and improving information sharing and engagement with other partners in programs. So I suppose it's to continue to strengthen a multi-sectoral focus on education, social protection, skills programs. But this balance between community-based support and the resources that UNICEF can provide for that, and a system strengthening state responsibility is important. And I believe UNICEF is developing some of UNICEF partners are developing some guidelines in this regard. The fourth one there that we have is that, and this comes up in many evaluations, I believe, but better operationalizing the duty to involve and consult children on processes that affect their lives, and how to seek meaningful engagement with children while respecting the do no harm principle. And in all of the countries there was complaints mechanisms, but they did not seem to be really functioning, or there did not seem to be a confidential reporting or complaint and response mechanism. So I suppose the recommendation relates to mainstreaming this in system strengthening efforts early on, so that we really move beyond lip service to kind of systematic efforts to, I think, reach out, but reach down to all levels of partners, like down in the regions as well. People may know about this in headquarters, but it has to get all the way down to the regional level and the local level. The fifth one there relates to the research and evidence. And, there was really a lot of interest in the research results noted during our interviews, and in particular, who children trust and how they feel about moving. The research done by Innocenti wasn't particularly on program outputs. It was more asking the children about how they move, what the dangers are, who they meet, who they trust. So the recommendation really is about making sure that, and this is happening already, but making sure that the momentum generated from this research gets down to local partners as well. The ones, particularly the ones who participated in the research, they were very keen to see the results, but using the results of the research. And finally, the sixth one relates to guidelines designed to support disaggregation of data. I think there are some guidelines for this, the expert group on refugee and IDPs statistics, and those kind of guidance that are designed to build the capacity of social service workers. I think the Global Alliance, Workforce Alliance does that. But to ensure that these disaggregation of data related to children on the move are continuously collected, so that you can see what works for different children with different characteristics, and ensuring that these indicators are not just quantitative data alone, but they're move beyond that as well. And I think a strong focus on gender in these indicators, even though it is collected, but what does this mean, and how does it affect, how does the situation differ for girls and for boys? Okay, so I would urge everyone to read the report. UNICEF presented it, the final report is presented in a way where it's very well laid out, so you don't have to read the whole thing at once, you can read different sections. But definitely encourage you all to read it and give your comments back to UNICEF. And I'd like to thank everybody who was involved, and back to Edward for questions.
Thank you very much, Una, and colleagues Lawrence, Aminul, and Tahani from the country offices. So just to tell in advance, we're going to go just 5 minutes a little bit beyond, otherwise we're not going to have time. We started a bit later. Sorry about this. So let me pick the questions that we already have, and please just type them in the Q&A function that you have at the bottom of the screen if you want to add something. So let me start picking them. I don't know if we will be able to answer all of them. So Gloria Damolekun said, good morning. Considering the limitations stated in the presentation, inability to hear from the children and unavailability of qualitative data, will the program be lacking an internal validity? Thank you very much for the question and for raising this really important point. I think this is such an important question that probably we're not going to have time to deal with it properly here, but without attempting to give an answer myself, just a couple of points. One is that, let me recover, maybe you joined a little bit later. Una mentioned particularly this point at the very beginning of the presentation, that the team, the evaluation team tried to mitigate this point by making use and extensive use of the research from Innocenti. And then the second element, which is what would take a longer time, is the discussion on internal validity. No, I assume that you refer not to the program, you refer to the internal validity of the evaluation itself. No, but then for internal validity, there would be other elements to consider, not only this one, as critical as it is, admittedly. No, I don't know if Una, you would like to add anything here.
About which aspects, Edward?
The issue of the challenge on internal validity of not having have access to the children, no?
Yeah, yeah, exactly as you said. About we used the reports from Innocenti, who had consulted with, I think, 1,200 stakeholders and children in the countries, and we read that very carefully, and it was kind of done in a consultative manner with country offices. We checked in with them all the time, and we were in touch with them quite a lot, and we validated our theories of action and provided feedback. It was done in a consultative manner, so it wasn't completely apart. But we were able to travel. The national consultants were able to travel in Ethiopia and Somaliland, and they weren't able to interview children, but they were able to work directly with those who were working with children. And I think that was very effective as well. So yeah, is that okay?
Thank you, Una. Just let me pick a question from Laurent Choupy. Hi, Laurent. It's a pleasure to see you here. So he's asking, Una, can you please comment on the theory of change that was used for the implementation of this program? What would be your advice for similar programs in the past, based on the learnings of evaluation? I think maybe he would mention also the theories of action and as the instrument used.
Yeah, yeah, the theory of action. I mean, the theory of change is very hard to develop at a start of a program, because you have these underlying assumptions of what will work, and a lot of it is really beyond your control. But the theory of action is more what UNICEF can do. So the theory of change was there, and it's kind of makes logical sense, but it doesn't take into I mean, the nuances, the political turmoil that happened, the COVID, how partners will react. So I found the process of doing a theory of change very interesting, because it shows that what worked with what to lead to what. And sometimes you can see that, different actors were able to, I know in Ethiopia, they were able to use some of the Innocenti research to develop the case studies for training social workers. So, that wouldn't have been in the original plan, but in the theory of action, you can see how things overlap and work together. So a theory of action is more related to implementation, I suppose. But if you compare them in the annexes, I think it's in Annex 2 in the report. Now the annexes are quite big, but just look at Annex 2 and you can see how the same outputs were there for each country, and they did it in a completely different way. And of course that refers to, that relates to the national context, the partners that were available, the UNICEF staff that were available. But I think it was good to do it. Yeah. Thanks, Edward.
Thanks, Una. Let's pick another one. Just to comment the second question that Laurent just placed on how some illustrations on how the program strengthened family tracing and reunification in Sudan. I would just suggest that to discuss this bilaterally with Tahani. Then there are a couple of other points, Una, if you could pick them. One is from Céline Couron. She's asking where there have been partnerships or collaborations, as you know, with UNHCR in the implementation of this program, and yeah, and what was from the evaluation point of view, what was the view, what was the take on this, and then second question, and just to close it, unless there is another one, yeah, there is another one, and if you can comment also a little bit on how the program, from the angle of the evaluation, how the program dealt with orphan children. So if orphan children were focused, were targeted, were singularized in the program, if this was revealed during the evaluation. Over to you, Una.
I guess the probably the details, the actual details of the partnerships should be asked to the program focal points. But we, again in our annex, we mapped all the partnerships that were there, and we felt that in some cases partnership with UNHCR could have been stronger. I think building on their experience of the tools that they use. I mean, I know that there was MOUs with IOM, and Lawrence spoke very clearly about the partnership with IOM, and I think it was similar in Ethiopia. The partnership with IOM worked very, very well. So I think probably the actual detail of who did what. Sorry, the other part on the partnerships was that the UN networks in the country, like in Ethiopia, was the UN network on migration, was one place where a lot of information sharing occurred, and the same was in Somalia and in Sudan. And we did find that, I mean, there's clusters on migration, and there's clusters on children and protection of children, and sometimes, you know, the two going together don't always, it's not always, the two of them aren't always in the same place. And it takes a lot of time for program staff to be attending these meetings all the time, but they're a very good place to share information and learn from what other partners are doing. There was a big EU program running in the region, Better Migration, and in Somalia, they worked closely with that program, but not necessarily in the other countries. And Sudan has a lot of partners they have a lot of programs. So, you know, I'd leave that up to you to contact Tahani directly to get more details on that.
Perfect, thanks, thanks, Una. And then on the question on the orphans, Noela suggested to consult with Kirsten, but I see that Kirsten probably had to attend some other event, so she's not here. Yeah, she's not here anymore. I would, sorry, Digangana, but we will leave this a little bit up to discuss with the team and with the country colleagues. We will come back with a comment on you bilaterally on this. So please, if you can send us your email address, we will come back. And then finally, just before closing, there's a comment from Belete Birara. Thanks for the presentation. Yeah, okay, it was just an acknowledgement. Thank you very much, Belete. So then let us close it up here, this part of the session, and I would really like to hand it over now to Noela Barasa from Child Protection Section. So if Noela, you could be so kindly to comment on a couple of things. No, I think one is of interest for everybody here and for all, not only for the countries of the program, but beyond, which is one of the recommendations that Una mentioned, is the one on the addressing the providing clarifications on the terminology, particularly on the terminology of children on the move. Would be good to hear what, as the coordinator of the program, from your angle, and as the group of people behind the management response of this evaluation, what would be your take up, and then on this, and then just to finish, because you will have the last word, if you can tell us what is the way forward also, from a more generic point of view beyond the action of the terminology. Over to you, Noela.
Okay, sure. Thanks, Edward, and thanks, colleagues Una and everyone for that really, colleagues from the country for the very succinct presentation, very clear as well. Maybe I just touch on the issue of the orphans very briefly, and in relation to this program, I think that it's emerging now more than last year in relation to COVID-19 and children without parental care now. UNICEF HQ specifically, and we have a colleague Aniruddha who's working on this, and just looking at potential scenarios in terms of addressing the program framework that UNICEF has in place to guide country offices in a response. So I'd say specifically for the HOA program, this was not something that had emerged, but then going forward, UNICEF HQ is working on programmatic guidance to support countries in their response to that particular issue, including terminology and how we're going to speak to governments around it, and identifying certain challenges around potential increase of children in residential care, etc. So for more information, I would just encourage get in touch with Aniruddha Kulkarni, who is working within the Social Welfare and Justice Systems program at HQ. For the way forward in terms of kind of some of the issues that arose from the evaluation, out of the broad 6 recommendations, of course, something that has been very recurrent has been the issue on terminology and what specifically children on the move means. We do have a global framework that outlines broadly who children on the move are. In terms of clarifying at national level, one thing that is the premise of this terminology is that, and as Una mentioned, is that we really want national authorities to respond to the needs of all children within their jurisdiction without a differentiation. Where the difficulties come in, obviously, is that for children under different categories of this broad umbrella term, there's a different response or path in terms of the response mechanism. So for instance, for refugee children, we have refugee protection mechanisms at national level linked to different ministries that may not necessarily be social protection, but need to interact to provide the necessary response. For migrant children, they may not necessarily fall under the mandate of UNHCR, but then we still need them to be protected without necessarily focusing on their status as migrant children, whether they are regularly or irregularly in the country. And there are certain task forces that are set up at national level that are focusing on various issues such as trafficking, mixed migration task forces, which are focusing more broadly on refugee, migrant, IDP, trafficked children, and other mechanisms that are not necessarily as comprehensive to address the needs of all the children within this broad categorization. So going forward, we would like to, number one, expand our conversation around how we have described children on the move within our global program framework. And then number two, the migration team is implementing a capacity building course with 2 more sessions, I think 4 days each, spread over the next six months, targeting our country offices. It's an internal course, but then just to expand and clarify knowledge and use of our terminology within the various categorizations that appear under children on the move. Maybe another issue that I can mention in terms of the management response, which we're working on and is due on 15th of July, is the issue around child participation and safeguarding. And we do have challenges around, kind of reaching different children at various ages. And this is something we discussed initially within the program, but then we were not able to clarify in terms of implementation and focused more on the older children. Secondly, in terms of safeguarding, we do have a child safeguarding policy at UNICEF, but then this is, at the policy level. Programmatically, there's been a lot of progress within the PSEA work stream to enhance our reporting, specifically linking to the beneficiaries of our programming. So we're going to be able to take that forward in terms of a lot of the work that the PSEA work stream is doing to link to our policy interventions. And we'll be able to monitor this over the next 6 months. And I think it will be useful more broadly for our programming in general. So I think those are the two main aspects I wanted to mention in terms of our management response, although we're going to be speaking to all 6 recommendations. And maybe just one more thing, recently we have launched our Children on the Move indicator guidance, and we hope that capacity building within this work stream will address this 6th recommendation on our data disaggregation as well. So just in closing, we want you to just look out for the management response. We'll be probably organizing a follow-up conversation on this together with other regions who have recently had evaluations on this similar programming to discuss the specific actions that will be taken for each and every recommendation, including the timeframes within which this will be implemented and the responsible actors that have been identified to take forward each action, also encompassing our country office colleagues. Over.
Thank you so much, Noela. That was very comprehensive. Just last point, there is in this presentation and the recording of the session will be available in the website of UNICEF. So unicef.org/evaluation, and then you can find it there. Or if you want a concrete URL, it's provided by Celeste in the Q&A window and answered questions. You will find it. And then just to close it here, I would like to thank Una and to thank all the participants and just pass it over to Beth to close. Thank you very much to everybody.
All right, thank you all for joining us this morning. Apologies for having started a bit late and having run a bit over, but want to thank you all very much. And as Edward has mentioned, the team is happy to follow up, so please keep the questions and the discussion coming. Thank you very much. I hope everyone has a great day. Bye-bye.